It's a dangerous public policy. It targets older people and those living with disabilities, the most vulnerable among us. But proponents of assisted suicide continue to bait and switch the facts, selling it as relief from pain and the ability to control when life will end. The truth is that it's about coercion and fear of being a burden to others and the high cost of healthcare.
It's a lot cheaper to grab a couple drugs and kill you than it is to provide you life-sustaining therapy. Simple as that.
The healthcare system remains broken. Insurance companies and hospital systems can bank on hundreds of millions in profits by paying for suicide, instead of providing real care and treatment. Despite effective advances in treatment and care that largely eliminate pain and suffering, patients with life-threatening disabilities are denied life-saving or comfort coverage. But in states like California, Oregon, and Washington, patients and their families get offered affordable suicide alternative, like Barbara Wagner and Stephanie Packer, whose new chemo infusion was denied 1 week after pro-suicide legislation passed. But she could have the lethal drugs paid for by state tax dollars.
Patients are going to die because of this.
But then there's the coercion and abuse regardless of safeguards. Despite the denials, a number of abuse and coercion cases are on record. There's Thomas Middleton, who died by assisted suicide just weeks after moving in with his estate trustee. She later sold his house, pocketing $90,000 of the profits. And Kate Cheney, whose daughter, who was, quote, angry and somewhat coercive, went shopping to 4 doctors until she found the one who would say yes to writing the lethal prescription for her mother. Fact is, the assisted suicide industry is rife with opportunities for abuse, offering hollow safeguards to protect patients. Those pushing assisted suicide say there's nothing to see here, while the coercion takes place behind closed hospital doors. We know assisted suicide is dangerous public policy driven by fear of disability, insurance costs, and that allowing assisted suicide for the few who request it leaves a much larger number of vulnerable people at risk of having their lives ended, and a culture of suicide that affects teens, young adults, veterans, and those experiencing depression. Comforting, life-saving care is here now and continues to advance every day. That must be our priority. Help protect the most vulnerable among us when they need us most. Please contact your representative to stop the drive to legalize assisted suicide.